we have Gabrielle Welch doing resident attitudes towards mock oral exams.
Sorry, it's a little bit different than what you guys have on your program.
I go with that one.
Yeah, I just wanted to be a little bit more specific about what we'd be talking about today. And I have no disclosures other than I am PGY2 at Yale. So we'll go ahead and get started. I want to talk about the impetus and why I wanted to develop a program of mock oral boards for residents, kind of how we went through that process, the development of a pre and post intervention survey tool, the results of that tool, and what to do with that information moving forward. So as you can see here, this is a picture of an oral board examiner, at least in the eyes of all of the, and some of the residents in training in the room. You know, it's a very scary time where you're going into a room one-on-one with an attending. You haven't had a lot of experience in that one-on-one interaction where you're not getting a lot of feedback from the attending and you're just kind of trying to recite everything that you've learned and consolidate it into nice, concise answers for them. And not every residency program has that sort of environment or has much exposure in that setting. So I wanted to kind of bring a relatively lower risk situation to our residents in order to kind of familiarize ourselves with that and get used to it, basically. So I spoke about this plan with my co-residents. So I brought it up to each class. I wanted to get their feedback, see if this is something that they were interested in or if this is something that they really don't want. Yale notoriously doesn't have a lot of Socratic method teaching, so I didn't want to introduce something that nobody else was interested in doing. I didn't want to force my opinions on anybody, but what ended up happening is this whole thing started in like mid-fall of PGY2 year. So it came out that pretty much the PGY3s and 5s were interested in it. Most of the PGY2s were not at that point just because they didn't feel quite comfortable yet. We brought this idea up to our program director, Roy Decker, who was very supportive and basically said that if you can find the time, I will be there to support you. I'll help bring attending buy-in. So ultimately, there were 9 PGY3s through 5s. I developed a pre and post intervention survey, which I'll talk about on the next slide. We had 9 attendings, and each resident took the test in 2 disease sites, since this was kind of a pilot. And these were all scheduled over the course of about 2 weeks in late April. They were an hour long, 30 minutes of cases, and then 30 minutes of a debrief time. So the survey tool that I created was really, I couldn't find anything in the literature that was validated and that could really answer the questions that I was trying to get at with mock orals. So I wanted to see which residents or how many residents have had experience with this sort of a situation, whether or not they felt that it was helpful or if they hate Socratic method teaching. I wanted to assess comfort with some of like the core pillars that I think that we really need to understand in oncology and be able to articulate in oral boards. And then as part of the post-intervention survey, asking how they felt about it, if they thought it was beneficial, what they would change. Overall, it seemed that there was very few prior experiences. So this graph on the left is the only one that has all PGY2s through 5s. The rest of the information is only PGY3s through 5s because they were the ones that actually participated. So very few residents had prior experience with Socratic method, case-based teaching, or mock orals. And overall, doing this intervention led to a change in perception. People had a more positive outlook on mock orals and on Socratic method teaching. In general, the p-value was not significant, but there was a trend. And in terms of how it changed clinical skills and knowledge, a little bit of a change across the board. 2 of them were trending into significance overall, and that was with comfort in articulating evidence-based treatment and comfort with articulating dose constraints, how you would discuss with your dosimetrist what to prioritize and what not to prioritize. And then we also had a section of qualitative question and answer so that residents could say what they did or did not like about the program. Overall, this is what they had to say, and to me, it was an overall positive response. I'm sorry. Okay, I'll speed up. So it just seemed that there was a slightly increased pressure for for the mock oral boards that really helped to direct people's studying to be more concise, more directed, learn to articulate the literature, and then having the debrief session with the attendings allowed to kind of learn your personal gaps in knowledge. These are just some of the other feedback, maybe decrease the time frame in the future and move it to not be right in front of physics or at bio boards because PGY4s were a little bit stressed out. Moving forward, everybody felt this was beneficial and really helped them in terms of preparing for real oral boards. A one-to-one situation creates some positive pressure that is like just enough to get you over the hump, and it's all about connections, making connections with the literature and discussing with attendings and kind of getting their insights. So thank you to everybody that participated in the exams, and also to Dan Bowman, who encouraged me to develop my own